This is the Emergency Medical Minute. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
Good morning, everyone. Thank you for your rapt attention. This is a little bit of a follow-up to a medical minute I did the other day, although I think it was a different crew. So we were talking about how you can tell on an EKG what region of the heart is affected when you're looking at a STEMI. And for that, you need to know a little bit about vector analysis, which sounds painful, but it's not that bad. So what an EKG really does is look at different regions of the heart from different angles with the electricity. Now, you would think that they would just label it because you put the stickers there, the right leg view, the left leg view, the right arm view, but it's not that way. They're labeled differently. So Nick's going to help me without any inappropriate touching, as we've talked about many times before. I'm going to be EKG man with chest pain, if this is my arm and leg. So I had a patient the other day who had ST elevations in leads 2, 3, and AVF. So show me by pointing with your arms where on EKG man that would represent. And AVF. So they're all looking inferiorly, right? So if you are seeing ST elevations in leads 2, 3, and AVF, you're looking at an inferior MI. And was anyone here the other day when we talked about different types of MI? So inferior, looking at the bottom of the heart, and there are a few complications that you can see with that. So often that involves the right ventricle, and do you know what's bad if we infarct the right ventricle? Pumping is bad. Well, pumping's bad in all parts of the heart if you infarct them. But in particular, the right ventricle is dependent on preload. So you're going to want to be giving them lots of fluids, and you can see kind of precipitous hypotension with right ventricle infarcts. So these are the people that, Nick has chest pain, we give him a nitroglycerin, and all of a sudden his blood pressure is like 70 systolic, and he's syncoped because we took away all that preload to his right ventricle. So that's one thing that you can see. So inferior infarcts can have badness early on. There's another part. It often it often includes the septum and leads, the AV node and the SA node. And so you can get sudden cardiac dysrhythmia, and in particular, they'll get bradycardia if they infarct that part of the heart. So those are the two bad things early on. Bad hypotension, especially with nitro, and cardiac dysrhythmias, especially bradycardia. The good news is, if you don't get the bad bradycardia and you don't get the hypotension early on in your course, inferior MIs actually do much better from a mortality standpoint than other types of MIs. So if you don't get hit early, it's really the best kind of infarct to have. And the mortality is listed as low as 2% from that type of infarct, whereas other types historically could be all the way up to 40% mortality. So that's it. Thanks.
Hello, EMM listeners. We are dedicated to providing you with high-quality educational content free of charge and without ads. As a nonprofit organization, we rely solely on donations. So if you enjoy our show and are able to make a one-time or recurring donation to help cover our operational costs, any amount is helpful in making this show possible. Click the link in our show notes to make a donation. Thank you.